Hi, my name is Michael Ho. I am the chair of the program committee for QCOR 2020. I am here today with Dr. Mark McClellan. Dr. McClellan is the Robert J. Margolis Professor of Business, Medicine, and Policy and founding director of the Duke Margolis Center for Health Policy at Duke University. I'm excited to be with him here today. He just gave our first plenary for QCOR 2020, which focused on improving cardiovascular outcomes and lowering costs, the AHA Value in Healthcare Initiative. So Dr. McClellan, can you tell us some key points from your lecture this morning on the AHA Value in Healthcare Initiative?
Thanks, Mike. It's great to be part of the virtual QCOR meeting, so timely, especially on the issues related to value in healthcare that are the focus of the AHA's Value in Healthcare Initiative. Mike, this grew out of the concern at the AHA and among its members that while we've seen dramatic improvements in cardiovascular outcomes over the last 50 years, over the last decade, that's leveled out. No further improvements, and cardiovascular disease remains the #1 cause of death and disability, despite having a lot of treatments available and a lot of ways to reduce risk factors that we just don't seem to be able to execute on effectively. And this work has had added urgency in the context of the pandemic, which has jeopardized access for care for many patients with cardiovascular disease and has required cardiologists and patients and everyone who works with them to adopt new ways of getting care. We're hoping that with these recommendations coming out now, we'll have a chance to really influence where our cardiovascular care system goes from here. And in the Valiant Healthcare Initiative, which is a collaboration between the AHA and a wide range of its supporting stakeholder organizations, healthcare leaders, people from the business community, and most of all, patients, we had 4 main areas of focus. One of these was on prediction and prevention and how we can actually implement better models to reduce risk factors and prevent costly complications. Something that's really important to do since those risk factors contribute so much to the premature death and disability associated with cardiovascular disease. We focused on stroke care and stroke risk, particularly related to undertreated and undiagnosed atrial fibrillation and high blood pressure, and identified a number of practical recommendations that physicians working with community groups and patients can take to address those risk factors. We had another collaboration focusing on prior authorization. I know something very frustrating to cardiologists today. I think people understand why there may be some concerns about the cost and use of some drugs, but it sure seems like there should be a more efficient way to do it. The recommendations in that project included some ways of streamlining how prior authorization could work through using electronic data standards and interoperability, but especially ways in which payers can work more collaboratively with cardiologists and other healthcare providers so that there's not the extent of conflict and extent of utilization review that's taking place today. And all of this relates to, Mike, the importance of moving to new care models that include things like telemedicine has become more prominent these days, ways of treating patients at home, ways in which cardiologists can collaborate with primary care providers, steps that can be taken to build out care teams, all of which are not very well reimbursed, if reimbursed at all, under our traditional healthcare payment systems. And so another big component of this project is so-called value-based care and payment models. And we have a pretty well-developed example of how that can work in cardiology care. We've seen these models come to primary care, to population focused approaches like accountable care organizations, to the hospital stays and rehab care associated with major procedures in cardiac care and hospitalizations for heart failure, we haven't really seen them move into preventing those hospitalizations in the first place, encouraging and supporting cardiologists to work with primary care providers and community-based care like telemedicine. And so we lay out a very clear model for how these kinds of payment reforms to support the needed changes can be implemented to get to better outcomes and lower costs. And then we back all of this up with an emphasis on new approaches to population-focused research, a project called Partnering with Regulators that outlines how clinical trials could be done more effectively, working with these real-world care systems and community-based approaches. I have some examples of how that's being done now to involve a broader range of patients, a diversity of demographic groups, disadvantaged groups into the care models, and have some specific recommendations there for how product developers and cardiologists who are involved in or want to be involved in testing new products can work more effectively with FDA and industry. So altogether, it's meant to be a way to reimagine how healthcare for cardiovascular conditions can work with some very practical recommendations. And as we're living in a time when people are really asking, how are we going to practice when we come out of this? We don't want to go back to exactly the way it was done before. And how can we support healthcare providers now who are struggling so much under their traditional fee-for-service payments to implement better models of care when we really need them today? We hope that these recommendations can help us find a good practical path forward to get that support for patients, for cardiologists and other clinicians that we really need right now.
Great. That was a nice summary, and thank you so much for giving the plenary talk. You can also read about a perspective that Dr. McClellan wrote in Circulation Cardiovascular Quality and Outcomes Journal, as well as a white paper, one of which was just published this past week in Circ CQO journal. Again, I want to thank you, Dr. McClellan, for talking with me today, and I hope you enjoy the rest of our QCOR 2020 virtual conference.
Thank you. It's great to be a part of it.